segment is sponsored by Keystone Compounding Pharmacy. If you're on a journey to reclaim your health or you want to know if you're predisposed to certain illness, you might want to consider genomic testing. Dr. Logan Morse is with Keystone Compounding Pharmacy, here to talk about what genomic testing is, how it's done, and who might want to try it. It's good to have you here.
Yeah, it's glad seeing you again.
Tell me about genomic testing. What is it?
So really it's looking at how our genes interact with each other, and that helps us figure out the conditions that an individual has and how we can better assist them through their journey.
To reclaim their health. The kit comes in a box, and you're going to kind of walk us through how easily this test is done.
Yeah, and it's super, super easy. So you'll open up the box and you get this nice little swab here. Swab goes in your mouth and you brush your cheeks for 30 seconds on each side. You just put it back in. You get a mailing envelope in there and you ship it off. And then there's a form that has to be completed. And then from there, once we get the results back, we walk through a patient on what their, depending on what their concern is and what the best therapy options are specifically for them. And that's what's so cool about this, is that you're not getting a one shot, like a one size fits all. You're getting an approach that's going to be specifically made for you.
So what exactly are you testing for or able to look for?
Yeah, so two things that I want to really go about through today. We can do a lot, but the two most important, I think, that people like is hair loss. So a lot of times women, they lose hair right through here, or because thyroid conditions can be an issue. They're concerned about hair loss and they don't want to wear a ball cap all the time. And so we're able to figure out specifically what type of medications for hair loss are going to help regrow their hair. And it's been fantastic. We see results, as soon as 4 months.
Wow.
The other one that I think is fascinating is pharmacogenomic testing, which is looking at medications and what types of medications someone's going to really respond to the best. And so, especially patients who are taking antidepressants, that's a really big one. They go through this trial and error of a lot of medications, so they lose a lot of time until they feel better, and they spend a lot of money on a medication that may not work best for them. So this saves them a lot of time and money in the long run, and they start feeling better faster than ever.
Okay, so hair loss and the more effective use of medications, those are two good motivations, but what are some of the other reasons that people would want to test?
Sure, so there are different protocols for like TBIs or for concussion protocols, things like diet and wellness. So if you want to know what types of foods you should be eating, if you're nutrient depletion, so if you don't have certain nutrients like vitamins and minerals and things of that nature, if you want to lose weight, there's gene markers all for those things that really we can utilize to help create better benefits for that individual.
So what about illnesses that are you're genetically predisposed to? Can you find that stuff out too?
You can look at things like cancer and really figure out based on their genome if they're more at risk for it. Now our test kits don't do that portion of it. There are test kits that do though.
Yeah, it's a fascinating thing that helps people to optimize their health and really dig deep and become more effective, I guess, in the way that they're treating their health. Well, if you are interested in giving genomic testing a try, or you just want to learn more about it, call Keystone Pharmacy, 616-974-9792, or visit their website. You can make an appointment at KeystoneRx.com. Good to have you here.